Okay, so here we have section 5E, transcutaneous pacing for adults and pediatrics. This is a paramedic skill. So if you look right here, it goes over the indications. We talked about these in this last video. It's your high degree heart blocks, your second degree type 2, and your third degree heart blocks, and then your bradycardic rhythms, either an acute coronary syndrome in preference to atropine use, or unresponsive to non-electrical interventions, or in pediatric patients when online medical control approves to pace this patient. Your contraindications are asymptomatic bradycardia. Again, we hit this on the last video, but we're not going to pace somebody that's not symptomatic. Just because their heart rate's low doesn't mean they necessarily need pacing. They could have something else going on, or their heart rate is just low to begin with, and some people's heart rates are just low all the time. So take that into consideration. For your unstable patients that you are going to pace, this is going to be step-by-step how you do it using the LifePak 15. If you look over here on figure 1, it shows the placement of where we're going to put those pacer pads. But we start on number 1, we're going to maintain standard ECG monitoring using electrodes and your cables. Number 2, apply the quick combo pads in the anterior posterior chest wall located in figure 1. Excessive diaphoresis may require drying, or excessive chest hair may be required partial removal to achieve appropriate pad to chest wall adhesion. Then you will connect your pacer pads to the monitor, and then if you look over here on figure 2, it has the picture of the right side of the monitor. You have your on button at the very top. Obviously, your monitor should already be on. They should already be on a 4 lead, and that's how you've determined that their heart rate is low. And then you have your defibrillation buttons, and then right under that, in that green box, that is going to be your pacer box. So before you do any of this, number 4, it says advise the patient of impending therapy, administer sedation if patient condition allows. Adults receive 2 to 5 milligrams of midazolam, also known as Versed, IV push as individual patient weight and hemodynamics dictate. So we should be doing this anytime we give a medication or anytime we do anything to a patient, just explaining to them what we're doing and why we're doing it. Getting paced is not a pleasant feeling. We're legitimately making their heart beat faster for them through a cardiac monitor. So it's not going to be the most pleasant thing that they've ever felt. So explaining to them what's going on, why we have to do what we have to do, and then if their vital signs allow, then sedating them with Versed to kind of ease that pain away from them. So we go to number 5, power on the pacing function by pressing the pacer button. If you look over in figure 2, again, there's that red arrow. So you're just going to click that pacer button. That pacer button will start blinking. It does not mean you're pacing them yet. You're just setting the pacer up. So you go to number 6, confirm the ECG rhythm is sensed by quick combo pads, looking for a triangular sense markers, marking QRS complexes, as you can see over here in figure 3. If you look over on figure 3, you have those upside down black triangles. That's going to be your sense markers. If the sense markers do not appear, check for correct quick combo pad attachment to LifePak monitor defibrillator. If sense markers are inconsistently tracking QRS complexes and or tracking T waves, adjust your ECG size or select alternate monitoring lead to achieve correct QRS complex tracking. So over here in figure 3, that's where you're going to want it initially. It's tracking your QRS. If you need to change your lead size to make it smaller or bigger, if you go back up here to figure 2 and you go to that left column, you can see the CPR button, analyze, lead, and size are the 2 small buttons. You can click on size and you can make your rhythm either bigger or smaller in size. So just keep that in mind. We'll scroll down here to number 7, the technique behind it. So you've already clicked your pacer button. The pacer button is blinking. Now you're going to select your rate. You have your rate and your current. So you're going to set the pacing rate at 60 paces per minute for adults, either by pressing the rate switch, the arrow right there on the rate button. You can either click that up or down, or press that up or down, and it's going to show you different numbers and you want to select 60 for the rate, always 60 for adults. If you're gonna, you can do this two different ways. You can do the rate button right under the pacer button, or you can do the speed dial. If you do the rate button, it will only allow you to change in increments of 10. The speed dial will allow you to change the increments in 5. So if for whatever reason you need to do 5 or feel better doing 5, use the speed dial. If you're okay with doing 10 and you can achieve it, you can use the arrows up or down right there. So after you click the pacer, you've set your rate to 60, you're going to go down one more button to your current button. That's also going to have the up or down arrows. The same rules apply for that as far as your increments. It will only let you change the increments in 10, whereas if you use the speed dial, you can change the increments in 5. So you're going to set the pacing current at a minimum level, achieving electrical and mechanical capture. We have to achieve both of these in order for this to be successful. So you'll be checking their radial pulse, and you're going to look for capture on the monitor, and then you're also going to look for capture for a good strong radial pulse as well. Number 9, it just talks about the pause button, which is right below there. Anytime you press the pause button, it's going to decrease their pacing rate by 25%. So if the rate is 60 like it should be and we decrease it by 25, it's going to decrease it to 45 paces per minute. We should never do this, in all honesty. The only time that we will do it is if online medical control is directing us to do it. And then number 10, if pacing therapy termination is required, power off the pacing function by pressing the pacer button. So again, that first pacer button right there, if you need to turn off the pacer, then that's the button that you're going to click. Just keep in mind, anytime we're pacing a patient, we're not going to stop pacing them unless for whatever reason online medical control instructs us to. So just always remember that when you start pacing a patient, you are going to be pacing that patient all the way to the hospital. And then the hospital will continue to pace them or do whatever the doctor feels necessary at that point. But once you start pacing them, you're going to be pacing them the rest of the time you have that patient. So just some other considerations down here. In the event that ventricular fibrillation or pulseless ventricle tachycardia, press the yellow charge button and it will automatically stop the pacing function, and then you can proceed with defibrillation. So this is just talking about if you're in a 3rd degree heart block and you're pacing the patient and they go into VFib, you can just do the yellow charge button up on the top right below the energy select, as you can see right there in figure 5. It will turn off your patient or your pacer, and then you will continue with your defibrillation and start your cardiac arrest protocol. Number 2, if the monitor displays ECG lead off during TCP, pacing automatically switches to non-demand and continues at a fixed rate until the ECG lead is reattached. So during on-demand or non-demand pacing, the pacemaker delivers pulses at the set rate regardless of the intrinsic beats that the patient may have. The patient continues to display the pacing rate and the current. To reestablish the demand pacing, we have to reattach the ECG leads. So it's always best if you're going to pace a patient to make sure your leads are on there good. If the patient's cool, pale, diaphoretic, wipe them off. Keep a towel handy. Keep extra electrodes handy. That way you can swap them out if you need to. Just try to make sure you have good sticker to skin contact there. And then number 3, if the quick combo electrodes detach during pacing, the monitor will display connect electrodes and pacing stopped. So that's when the pacing pads are off, or they come off or get unplugged. That's what's going to pop up on the monitor. The message and the sound will alarm. The set pacing rate is maintained, but the current resets to 0. So reattaching the quick combo electrode silences the alarm and removes the message, but the current will still remain at 0 milliamps until manually adjusted as described above. A little bit farther down here, just pacing considerations. Proper electrical capture is displayed by depolarization of the ventricles reflected as a wide QRS, followed as a distinct broad T wave. Absence of these findings immediately following pacing spikes generally indicates failure of consistent electrical and mechanical capture. And then number 5, with transcutaneous pacing, it may be difficult to see the paced QRS complex due to washout from the pacing stimulus. It is imperative to confirm capture by physiologic measures such as a pulse. That's why we confirm it in 2 different measures, mechanical and electrical. And it just has some examples over here, figure 6 through figure 9 of different rhythms that were being paced. So the big thing to remember with this, we kind of hit it earlier, is once you start pacing the patient, you're not going to stop pacing the patient. So, and I'm speaking from experience when I say this, when you start pacing the patient and you get them to the hospital, you have to remember that your life pack is what is pacing that patient. That's what's continuing to make their heart beat at a good rate. So when you get to the hospital, make sure that you explain to everybody in the room, doctors, nurses, other EMS staff, firefighters, that we are leaving the patient on the monitor. So everybody knows how it is when you get in the hospital. They try to get the stretcher out. They try to get the monitor out as quickly as possible. They start throwing stuff on the stretcher and wheeling it out. We have to keep the monitor on the patient. Whatever you have to do to explain that to people. Again, speaking personal experience, as I went to the ER one day with pacing a patient and the charge nurse unplugged the wires and put it on the stretcher, and the patient went into cardiac arrest. So we want to avoid that at all possible, and just remember that our monitor is what's pacing that patient's heart. So keep that in mind. And again, as always, if you have any questions, feel free to reach out.